Welcome to the first day of our iCON Health Forum. Um, our theme for this week is going to be Take Charge of Your Health, Dementia 360. Please click on preview if you want to join the forum.
So we would like to acknowledge our iCON office is situated on the traditional ancestral unceded territory of the Musqueam, Squamish, and Skalukit peoples. I would also like to acknowledge that you are joining us today from many places near and far and acknowledge the traditional owners and caretakers of those lands. And there are a few announcements. First,
thank you very much. Thank you. I think that on screen you can, some of the participants have done this before, have joined our activities before, and today I'm just going to make a simple introduction of what iCON is all about. Hopefully that some of the participants will know. So the iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at the University of British Columbia. The main purpose is to help people in multicultural communities, including Chinese communities, understand how to prevent and self-manage chronic diseases by organizing health seminars, workshops, and using internet technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will actively participate in seminars and other activities, we also hope that the sharing of this health information can be extended to more remote areas and overseas through live webcasts and help everyone work together to improve their health. All right. First of all, I want to introduce from the lead of digital medicine, emergency medicine, and the founder of iCON, Dr. Kendall Ho, to give you a warm welcome. Kendall. All right, Barbara, thank you. Well, everyone, our friends online and the Cafe Nursing Home and the Mineral Community Center, we thank you for your active participation. I am Kendall Ho. I am at UBC. I am one of the professors at the School of Medicine at UBC, and I'm also the executive director of iCON. On behalf of the university and on behalf of the Ministry of Health, I thank you for your participation. And I know that it's been for 2 years that we've had this pandemic, so it's affecting us to the point where we have to do this online. I hope that in the near future we can sit together and then we can actively participate and know each other and know more information. And I know that today we thank you for your active and your enthusiastic support online, and then we can meet on the air. I know that there are some good friends, old friends, and there are also some newcomers, and thank you for your participation. I hope that today, this subject on the talk of dementia, we can get some insights into this issue. We also thank many media partners. They help to promote this forum, and they're also exhibitors, health exhibitors, like Barbara said just now. Those you can visit within the next month. So every time after we have spoken, we will introduce 1 or 2 exhibitors to you. And we also are very thankful for the community partners. Today, I'm not able to thank them all, so I'm not going to thank them one by one. I'm very happy that at this point in time, I know that there are many speakers who will share with us their information, and I'm not going to delay that process. But before they do that, I am very honored to be able to invite the representative from the Ministry of Health in BC as Lindsay R. Scott.
I would like to invite Ms. Lindsay R. Scott, who is the Director of Primary Care Quality and Primary Care Division of BC Ministry of Health. It's a huge pleasure to have her here join us today, and very kind to have her present to us opening remarks. So Lindsay, I'd love to pass this over to you, and thank you so much for being here.
Thank you, Kendall. Thank you for the opportunity to provide opening remarks at today's Chinese Health Forum, Take Charge of Your Health, Dementia 360. I'm Lindsay R. Scott, as Kendall said, the Director of Primary Care Quality within the Primary Care Division of the Ministry of Health. I would like to acknowledge and offer respect and my gratitude to the Lekwungen peoples on whose traditional territory I'm located on in Saanich, and to the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I would also like to acknowledge the Métis Charter community located in Victoria. Patients as Partners is based on the motto of nothing about me without me. We believe that engaging patients and their families, healthcare providers, and community partners in healthcare is not only the right thing to do, but is an effective way to make the health system better and the people of BC healthier. Patients as Partners has collaborated and funded iCON for over 10 years with Dr. Kendall Ho as the executive director for all of that time. When iCON started, they brought hundreds of people together to learn about managing chronic diseases. And over the years, iCON has continued to bring healthcare providers to speak to people in their first languages about topics people want to learn more about. This health forum brings together a number of presenters whose aims are to increase understanding of what dementia is and how to recognize it. Importantly, they will provide resources and strategies that you and your family can use to empower and optimize your quality of life. For me, today's topic is particularly important as my grandfather suffered from dementia. Having access to today's information and resources could have increased not only his quality of life, but my family's. I want to thank iCON for bringing us together today for this discussion, and I invite you to check out their resources after the discussion. Also, take a look at our patientsaspartners.ca website for other resources and more free educational events for patients and families. Again, I want to express a big thank you to our presenters today, and I appreciate your time and look forward to learning more. Thank you.
Great. Thank you so much, Lindsay.
Thank you again, Lindsay, for this opening remark and your support. And now I will pass the mic back to Barbara, and our forum starts now. Thank you, Doctor. Today, our theme is about managing health, Dementia 360. So you can tell that we hope that we can offer a series of topics on this theme to give you more insight into this issue. And there are so many things that we're going to cover today and tomorrow. For today, we want to recognize what dementia is and what the symptoms are and how the importance of early detection and when you will need to seek help and how to treat them, how to treat it, what are the medications to treat it, and how to how to interact with patients with dementia. And for tomorrow, there is another part of this. We're going to talk about nutrition for dementia patients and their mental health, as well as their home safety, as well as their long-term care. So when the patient will need to go into long-term care and also other care aspects, which we will leave for tomorrow.
And today, I'm very honored to have Winnie Lau, a registered psychiatric nurse who is very experienced, to talk about management communication strategies for caregivers. So we are very honored to have Winnie, our psychiatric nurse. Yeah, I'll pass the time to you, Winnie. Thank you. So thank you. I'm very happy to come on to the iCON Health Forum so that we can discuss communication. So when we talk about how to communicate well with doctors or communicate well with the patient, and even among our family members. So first of all, we learn how to effectively communicate with family physician, just like when you go to see Dr. Ma or you see Dr. Wong. And most patients think that they are okay. They will say, well, I am okay. How come you take me to the doctor? It's you who have problem. Why don't you go? And sometimes we have difficulties getting somebody to the doctor. And for our service, sometimes the patient may say, well, why do you come to see me? I am okay. And sometimes we say, well, your family doctor is worried about you, so that they ask me to come and check you out so that we can report back to the family doctor. And that person who is bringing a patient to the family doctor, or we as the mental health team to visit the potential patient, then usually family members are present. And that person is very essential. That person is a key person. And we suggest there is one key person, a spokesperson. That is very important role to play because that person has to observe all the important changes or to keep track of all the questions for the family doctor, to take note of that. And then sometimes you have to present those in a very short period of time, because you can, as you know, some family doctors are very busy and you may only have 5 minutes to get through all your questions. And even for the specialists, yeah, their time is precious. So my suggestion is, before going to see the doctor, I think the family members have to sit down and do some sort of preparation, like doing some homework. For example, writing down changes in the everyday life. Changes in life would include the behavior, and then you have to write it down in details. For example, the person may all of a sudden open the door in the middle of the night. And then when you ask the person, why do you open the door in the middle of the night? That person may say, well, somebody is knocking at the door. Don't you hear it? Yes, I hear somebody singing or dancing outside the door. So why don't you see it? And these are all examples of behavioral changes. And in this case, some people may have hallucination, and you have to note and write down whether this happened more often in the middle of the night or what time of the day. Another thing is about emotion. So if you find a person more agitated, or he seems to be a victim, and he is having very low moods, feel like crying. So these you have to note down for sure. Another thing, you have to write down physical health. For example, a fever, and people who have been having hypertension, and during that period of time, and I think most people have a blood pressure monitor. So within those weeks before seeing the doctor, take blood pressure more often, keep a record of that, and present the record to the doctor so that the doctor can make a clear assessment. And for example, if the patient has, it was the diabetic, so within those 2 weeks, make more frequent checks of blood sugar. Another thing may be sleep. And if you see the person is not having good sleep, then you have to check whether he is or she is more having difficulties falling asleep or getting up in the middle of the night. For safety at home, so you check whether the person is walking steadily, having any falls, or appetite. would the appetite be affected? There are many reasons for affecting the appetite. So that's why within 2 weeks before seeing the doctor, you keep track of the body weight. Or if you have been having regular visits to the doctor, then at least you keep a record of the body weight. Because sometimes the scale at the doctor's office may differ from the one at your home, so that you can keep track of the weight at home and then compare with that at the doctor's office. And the main goal is for the elderly to have good care and good service, and the person would have a stable life to stay within the household and reduce the stress towards the family members. Another thing we would like to talk about is how to communicate with family members living with dementia. I totally understand taking care of people living with dementia is really stressful and challenging. And then if to communicate with them, it is even more difficult. So usually I would suggest when communicating, make it simple. Speak slow, keep messages short. So don't keep your conversation too long or with multiple instructions, because the family member may not be able to understand. And sometimes they may be having different abilities in expressing themselves. I'll give an example. So after they have gotten up, they would put on a clothing and then brush your teeth and then go for breakfast. So if you start telling the person all these 4 steps, then it will be overwhelming. And the elderly would wonder, well, what is the first thing that you would like me to do? So why not stop, take a step back, and give short and simple instruction. So the time may be more lengthy, you may spend more time, but they can understand you better. For example, Mom, you get up. Okay, why don't you put on a coat and then take her to the washroom? When she is done, and then you tell her, well, why don't you brush your teeth? And after brushing the teeth, then you say, oh, let's wash your face. And after that, you take her to the dining room for breakfast. Although it takes time, however, the elderly would take in messages in sections, and then she would understand it very clearly. And for questions, so don't ask abstract questions. The best thing is to ask yes and no questions. Now, for example, so you may ask, oh, Mom, what beverage would you like to have this morning? So for her, then it will be difficult to make a choice. So in your mind, you may have her favorite drinks. So you can ask, would you like to have tea or water? And then it would be much simpler for her. And then she may come up with the idea and say, oh, let's have water. She not only understand, but she will not be overwhelmed by us by saying, oh, you're asking so many things and I cannot respond. And also try to make the environment quiet. I know many of our elderlies may experience difficulties with their hearing. And then when they have a hearing problem and disturbed by background noises, then they wouldn't like to concentrate. And sometimes we bring a pocket talker. And just like what I'm doing right now, I'm wearing a headphone and then I'm holding the pocket talker, and it would be much easier for us to communicate with them. Of course, we would have good eye contact, and we may have cueing, and we may be holding a certain object so that they would know what we are talking about. And finally, which is important, avoid criticizing or arguing. So if you do that, so they will be agitated, and so would yourself be. And that will be a lose-lose situation. For example, if you say, every time when you go to the washroom, you forget to flush. I've reminded you so many times. Of course, they don't understand. They may forget everything after 5 minutes. They will be asking you every day, have I had my meal? What day of the week is it? So, well, forgetting flushing the toilet is really something challenging to them. So therefore, don't argue. So if they haven't flushed, just go in and do it for them. And then sometimes when neighbors have moved, then, well, if you argue with them and they would think the neighbor has moved away. So if that doesn't affect anything in your life, so just accept it. Oh, really? Oh, the neighbor has moved. Okay, why don't we go out? Why don't we take a meal and try to forget it? So try to change the topic so that the person would not dwell on the same idea and being affected emotionally. So in that case, it will be a win-win situation. Okay, and finally, we learn how to navigate discussions about treatment with family members. As everyone knows, if there are a lot of siblings in the family, everyone has his or her own thoughts, and the caring strategies would be very different. So sometimes it will be quite challenging. So as Chinese people, we say, every family has their own stories. And therefore, on the whole, when we take back and think about this, so the most important thing is to allow the elderly the best service, the best care, and also respecting the concern and the wishes. And at the beginning of the stages of dementia, then discuss with the family member, what are your wishes down the road? And if you have the same ideas and beliefs, communication is usually easy. So in the old days, when the family members, you usually would have a logbook, and people would write down in the logbook what has been done. For example, bathing has been done and so on. And now with technology, everyone relies on the cell phone. And therefore we use the social media groups a lot, and that which is very good. For example, we can communicate in the groups saying, oh, I took my dad to Dr. Wang today, or I have changed the medication and I have filled the prescription. And through the social group, the whole family would know what is happening to the elderly. And then with a good communication, education is important. Just like today, when you join our forum today, or if you join in support groups, then even everyone knows what stages of deterioration of the disease may be, and even knowing all the methods of communication, and you know the supports that is offered in the community. But it seems that when you revise and then you revisit all these ideas, then you may be reminded. You may say, oh yes, I have forgotten there is a method that we can use. And therefore, in those support groups, different families and members from different families can share their experience, and then they can have more support. And for example, my dad could be a mild dementia patient, but for the other family, the parent may have been in an advanced stage. And then by communicating, you can learn a lot, and you can bring it back to the family and share information with the family, and that will be superb. Finally, a lot of our elderly people cannot manage living in the household, and they have to go to long-term care facilities. And before going there, actually, the long-term care facilities would ask what are their favorites, what are their favorite goods, what food, what are their favorite activities. So their wishes would be for the residents to get used to the environment as soon as possible. And usually after 1 month, there will be a care conference, and they would welcome all the family members, not just the key person, but every family member to come to join the care conference, because their ultimate goal would for the residents to get used to the long-term care environment so that they can offer support to the residents. If you would like to learn more about long-term care, the facilities, and so on, so tomorrow, my colleague Miranda will give you lots of information. Thank you very much. Thank you, Winnie. So when you talk about how to help patients with dementia, increasing the communication capacity, that is excellent.
Now, I want to thank all the speakers of today, and there are also many community partners who have supported our activities. And I want to thank the Ministry of Health of BCA Patients as Partners Initiative, this project to support our work. And our community as partners, there's so many partners: Mosaic, Canadian Mental Health Association, Alzheimer's Society of British Columbia, Diversity Self-Management, South Vancouver Neighborhood House, Family Caregivers of British Columbia, and RCMRG. So, and also media partners who sponsor and support our activities so that we can have such a huge audience to join us in today's forum. Thank you very much. And finally, we thank our exhibitors, our health exhibitors. Right. First of all, I want to thank the health exhibitors. What I want to tell everyone is that there's going to be a month-long exhibition there. For example, our Alzheimer's Society of British Columbia and the Canadian Mental Health Association, as well as Success and South Vancouver Neighborhood House and Richmond Gives, Family Caregivers of British Columbia, and Diversity, and our own iCON network will also display information there for 1 whole month. We also want to thank Richmond Gives, who in our community center has a viewing party, and also want to thank Cathay for hosting a viewing party. For now, that's all for today, and I will thank you in English. So remember, tomorrow, 2 p.m., we are going to continue our talks on different topics. And tomorrow, we're going to talk about nutritional knowledge on dementia, our nutritionist, Jojo, and the mental health of patients as well as their caregivers, Dr. Tigerson Young, I'm sure you know him well, and also safety and long-term care. And we have Wendy to host this talk. You're all familiar with her. She's a registered occupational therapist. So I hope that everyone will join us again at 2 p.m. tomorrow on air, and we will share a lot more information with you. So hopefully we'll see you again tomorrow. That's it for now. See you tomorrow.